It is yet another year and the issue of medical interns allowances has resurfaced. For years, the payment of allowances to medical interns has been a recurring concern, at times resulting in protests and strikes. This year, the medical interns are challenging a new government policy on their facilitation. At the end of last month, government deployed 2,417 medical interns to health facilities across the country and were expected to report by August 3rd. But the deployment came amid concerns over changes in government policy regarding the payment of medical interns allowances. A number of interns have reportedly not reported to their assigned facilities, citing uncertainty over whether they will receive any allowance.
You cannot expect to deploy someone without telling them how the allowances will be. You deploy them in remote areas. Imagine someone from maybe the central region is put in the deep areas of Kotido, and you're telling them you go, you work, but you're not going to be facilitated. Your allowance, your accommodation, your feeding, we shall not facilitate any of that. We have found that it has destabilized interns and made them unable to report to their sites.
We are not against service. We have not refused to provide service to the citizens of Uganda. But we are just requesting for basic living standards. We are just requesting for allowance that can allow us to effectively perform our duties.
The government has, however, said the policy changes do not affect government-sponsored medical students, but the interns have rejected this position. Whether they are government-sponsored or privately sponsored, they say they all perform the same duties in health facilities.
It's not only malicious, but it is even unethical. And that's why even the government, the so-called government-sponsored students, have also not supported it, and they have not been able to report their workstations. We do the same workload. We see the same patients. We do the same duties. It is simply unimaginable to say that you're going to pay one who has started on government and you not pay the one who started on private when they are delivering the same. That one, we can say that it has been rejected across the board.
The medical interns say although they are often regarded as students, they have disputed this. They say they perform critical duties in health facilities, including working long hours and contributing significantly to patient care.
Medical interns are not students. We are fully graduated. For example, medical doctors, as I am, pharmacists, nurses, midwives. We do hold our academic transcripts and our degree certificates. We also have provisional practicing licenses from our respective councils, such as the Uganda Medical and Dental Practitioners Council. So for us to get the full practicing license, we have to undertake this 1 year of working under supervision by the senior consultants. Now that doesn't make us students. On top of them being able to execute almost 75%, actually 75% of the workload in our facilities, they also run long duties, a minimum of 36 hours, others 48 hours, non-stop. That leaves them with no option, no any other alternative of survival. And their only livelihood lies on this allowance that has been coming from the government.
In 2021, President Yoweri Museveni directed medical interns be paid an allowance of 2.5 million shillings per month, set at half the starting salary of a fully appointed medical officer. However, implementation of the directive has been inconsistent, with the Ministry of Health citing budget limitations. Last year, medical interns received 1 million shillings as their monthly allowance. The new policy that leaves them without any allowance has sparked concern, with the Federation of Uganda Medical Interns calling for the 2021 presidential directive to be implemented.
We further request that the 2.5 monthly allowance directed by His Excellency President be restored and paid free of any form of taxation, given how far short of a living wage it already falls. It is this that pushed the Medical Interns Committee to notify training sites in writing that interns will not be reporting to their stations until the concerns are resolved.
The Federation is also questioning the deployment of 2,417 interns, saying some medical interns were not deployed and calling on government to look into the matter. The interns also say the meeting with the Ministry of Health did not yield a solution to their concerns. Away from the issue of allowances, the medical interns are also protesting the new policy that will extend medical training from 5 to 6 years.
In my personal opinion, it's something that is targeted to make sure that they do away with the allowances of interns, because we know that medical students cannot be paid. And if we don't want to pay medical interns, then we make them students. However, it puts patients' lives at risk, because think about a student doing an operation on someone. These people do not have any legal or ethical accountability because they are still students.
The Federation of Uganda Medical Interns is now calling on Cabinet and Parliament to address their concerns.
We therefore like to make another more outcry to the Cabinet to consider this a matter of public interest and urgency.
Nobat at Kunda, NTV Weekend Edition.